The country's only anxiety and depression helpline has been flooded with calls during this time. People are stressed by financial insecurity, loneliness and fears brought on by exposure to police brutality. Andrew Kim's a medical researcher with the South African Medical Research Council and Wits University, as well as being a contributor to the Baker Cisa Centre for Health Journalism. He joins us now. Andrew, good day to you. You were able to speak to people living in Soweto. You found that people who thought they might be vulnerable to contracting the disease were more likely to suffer from depression. What link did you find?
Yeah, so, in our study of around 220 adults living in Soweto, we found that individuals who reported greater levels of self-perceived risk of becoming infected with COVID or being affected with COVID corresponded with greater levels of depressive symptoms. So a variety of different symptoms that increase an individual's risk for major depressive disorder. And this is within the first 6 weeks of the lockdown, so from the end of March to the beginning of May. We also did some qualitative interviews, and we also found that, even though people didn't think, a majority of people didn't think that the experiences of the pandemic affected their mental health, we still found a significant portion of individuals reporting things like anxiety, fear of infection, thinking too much, which really, and this discrepancy is a bit concerning given the fact that because there's a high level of stigma on mental health and mental illness, people may not necessarily be aware of the impacts that the pandemic is having on themselves.
In other words, people just don't realize how bad it actually is. I mean, you sort of forget sometimes that we're living through a pandemic, and yet you'll still remember to wear your face mask. All of this actually has an impact.
Right. No, absolutely, absolutely. And, we also see, not just in Soweto, but also across South Africa, we've, especially in urban areas, we've seen individuals anecdotally just relapsing at higher rates, coming to hospitals because of adverse effects of drug use, especially if they weren't able to pick the script or just trying to cope. But we've also seen, these problems that have always existed in South African mental health systems. So that's things like stockouts, an overburdened and underfunded healthcare system, and fewer beds, especially during the time of COVID.
I have to say, I don't think we've actually begun to realize the mental toll that all of this is taking of COVID-19 in our country, on our people. Are we ready to deal with the implications of it? I mean, are we likely to find in the longer term? I'm talking children at school now who've been disrupted in 10, 20 years might find that they're actually, still waking up with nightmares about this thing they can't see. They just know it's dangerous.
Yeah, that's a great question. I think right now, because we're also, in the midst of the pandemic and other countries are still just recovering or have, overcome their peak in recent times, we're still trying to get a sense of what the long-term mental health impacts are of the pandemic and its secondary consequences. But, there is a possibility that there could be these long-term health effects. And what we do know is that the pandemic has introduced new barriers to both to accessing mental health care specifically. So things like going to the dispensary to pick up a script, even going to the clinic or hospital. I spoke to a psychiatrist at the district health clinic in Joburg, and she told me that they saw fewer patients attending visits because of these, interprovincial travel bans and fear of infection. But providing mental health care services over the phone and trying to think about new ways to innovate the delivery of mental health services, I think now is a very important time to consider. It always has been, especially with the high burden of mental health, but now is definitely a major time and a major call to try to identify new ways to deliver mental health care services.